Thank you for listening to Depictions Media Radio. Artificial intelligence. We've all seen the science fiction version of a artificial intelligence being used as a doctor in things like Star Trek and various movies about how the computerized doctor scans us and cares for us and puts the person back together again and figures out what is really wrong with them. With artificial intelligence, like anything else, it's like your Google search. There's a huge database behind that, and the problem with huge databases also comes privacy laws, and we're not just gonna. It's not just an ethical thing to talk about when you're talking about health, to talk about intellectual property. You're also talking about, hey, you've included me in a database that is about what's going on inside my body. And how should that be shared? Who should that be shared with? Who should have access to that? That sort of thing. So there's a lot behind the ethics of artificial intelligence used in healthcare. There is also a lot to deal with accuracy. How is this really going to help make people healthy? There are a lot of things to be considered with artificial intelligence. How different databases will be used, what will they be used for, to make people healthier. Drug development, treatment development, that sort of thing. So, a discussion around artificial intelligence at the World Health Organization can become quite the conversation. I haven't even touched a lot of what could actually go on. While I do have a background in sciences, my background in sciences does not actually include medicine. It includes very many other things, but not medicine. And there's a lot to be considered. There's a lot of legal terms. There's a lot of international legal terms about what should be shared, and also ethical terms about when you consider that in order to fill your database with results, who are you going to get the results from, and how do we protect the vulnerable people within our global community that where countries have lower incomes and things like that, to keep them from being just simply guinea pigged. So there's a lot to be considered, a lot of ethics, a lot of laws, a lot to be wrapped up in artificial intelligence used in healthcare and global healthcare. And there is an actual importance when we discover, as we discovered with the pandemic, that such a system could be very valuable in curbing a pandemic from happening also. So, checks and balances, that's what the WHO, when it comes to global healthcare, is about, reviewing what different countries are able to do and what they're willing to do in order to save lives. So let's move forward and listen to what the WHO actually has to say about the ethics of artificial intelligence. There will be on depictions.media, there will be a PDF download of a complete report that has been put together by the WHO around this topic. So for those of you who have the ability and the desire to review that, I will actually make sure that report gets put on depictions.media for public review. All right, so let's go on with the press conference.
Okay, good morning, everyone. Thank you very much for joining us for this virtual press conference from Geneva. We have sent you the media advisory, and we have sent you recorded material for the launch of the first global report on artificial intelligence role in health and 6 guiding principles for its design and use. This report, called Ethics and Governance of Artificial Intelligence for Health, is the result of 2 years of consultations held by a panel of international experts appointed by the World Health Organization. Today with us, as we have announced in a media advisory, to speak about this report and about the topic in general, we have Dr. Soumya Swaminathan, WHO Chief Scientist, Professor Effie Vallena from the Institute of Translational Medicine in Zurich. She is the co-chair of the WHO Expert Group on Ethics and Governance of Artificial Intelligence for Health. We have also Professor Partha Majumdar of the National Institute of Biomedical Genomics in India. He is also co-chair of WHO Expert Group on Ethics and Governance of AI for Health. With us is also Andreas Reis from WHO's Department of Ethics, who worked closely with this expert group and who also may help us answer some of your questions. So the report and the press release have been sent to those who have asked for, so I hope those who are with us online have already read it. We put the embargo time 10:30. This is when we will post the press release and the report itself and send it to the global media list. So you have opportunity now to get some quotes from our experts and co-chairs on this very, very important and new topic. So with this, just to remind you that if you would like to ask questions, please click raise hand icon, and we will come back to you after the opening remarks. So with this, I'll give the floor to our Chief Scientist, Dr. Soumya Swaminathan, to tell us more about this topic in general and why WHO decided to convene this group. Dr. Swaminathan, please.
Thank you. Thank you very much, Tariq. And good morning, and as well as good afternoon and good evening, ladies and gentlemen. And special welcome to the co-chairs of this report on ethics and governance of artificial intelligence for health, Effie Vallena and Partha Majumdar. And I'm very happy to be with you at this press conference because I think this report is one of those which indicate the direction in which WHO is moving, particularly since the time of the creation of the Science Division in 2019. One of the goals of the Science Division is to make sure that WHO stays ahead of the curve, that we anticipate new advances in science and technology that can bring benefits for health and public health in particular, but also along with those advances that we recognize some of the risks or challenges or concerns that we need to be aware of, because every new advance in science, every new technology has, along with its positives and its benefits, always or mostly comes with some potential possibilities of misuse, challenges for use, and other ethical issues that need to be addressed. And at the creation of the science division, we recognized that artificial intelligence is one of those rapidly exploding areas of science that's being used, of course, in many, many disciplines, not just health, but at WHO, we are concerned about its applications for health. And we have seen already in the last few years the enormous opportunities for strengthening the delivery of healthcare and medicine. And particularly for us, the key issue is, can AI and AI-based tools help to advance the universal health coverage goals of the world, actually, of the Sustainable Development Goals. We have seen in many countries the applications and use of AI for enhancing diagnostics, for example. That's one of the most commonly used indications, reading x-rays, reading scan reports, reading pathology slides. This could be very useful in areas of the world where there is a lack of these specialists, lack of radiologists, lack of pathologists. And with the use of the internet and the possibility of sending images to remote locations, you could really speed up the reading of these images and the return of results to the patient as well as to the treating physician who may be in a completely different part of the world. This is being tried for diseases like tuberculosis, for example, as well as for cervical cancer and many other indications. It's being tried also in COVID. Now, it's also being used for improving clinical care, for developing algorithms that can help healthcare workers to think through the possibilities that a particular patient is presenting with, to think about various treatment options. It could also help with surveillance, with outbreak response, health systems management, and in the area of drug discovery. Many companies are now using artificial intelligence to screen for potential drug targets and for the research and development of new drugs. Now, at the same time, the ethical issues that or concerns that this raises are around equity, the digital divide. We know that again, one of our mantras is to leave no one behind, and the possibility of a digital divide, people who have less access to the internet services, particularly to broadband, do not have smartphones, for example, the possibility that they could be left behind if healthcare systems switch to using a lot of digital tools. That's a concern. Data protection, where is the data coming from? How is it being stored? How is it being used? Who has access to it? The private sector and the public sector with the ways in which they handle data. Then about liability, who's liable if there's a mistake that's made that's based on artificial intelligence system? Is it the developer of the system or clinicians or hospitals? And how will these tools alter the relationship between providers and patients? And then finally, how do you regulate the private sector in this area, which includes some of the world's largest technology companies? Now, these are questions being asked by a lot of people, and to address some of them, WHO actually established an interdisciplinary expert group consisting of 20 specialists from ethics, digital technology, law, human rights, as well as people who've been working in ministries of health and physicians. And after about over a year and a half, actually, of very intensive deliberations of the expert group, starting with one in-person meeting, but then really discussing virtually, I'm delighted that we today announced the launch of the WHO guidance on ethics and governance of artificial intelligence for health. This guidance contains a set of consensus principles that will provide guidance to AI developers as well as to ministries in countries. So it's not just the ministries of health, but I think this is where the ministries of information technology or data, communications, etc. also play a role. So it's across government really that these principles would need to be considered. And it also provides guidance for clinicians. It features some checklists with some concrete steps that could be taken, but you will hear more about this from our co-chairs. Thank you, and back to you, Tariq.
Many thanks, Dr. Swaminathan, for these opening remarks. Before I give the floor to Professor Baena to tell us more about the report and guiding principles when it comes to artificial intelligence role in health, just to remind also those online that there will be webinar for policymakers later today from 12 to 1:30 with the speakers including Dr. Tedros, WHO Director General, Dr. Swaminathan, Bernardo Mariano from our Department of Digital Health, and many other guests. So that is at 12 o'clock, and we have included that information in the media advisory that has been sent with you. For those who would like to have some questions, please raise the click the icon, raise the hand, and now I give the floor to Professor Effie Baena to tell us more about the document itself.
Thank you, Tariq, and thank you, Dr. Swaminathan, for the introduction and for your leadership in actually putting this topic on the map, on the global map, which is very, very important. I had the privilege, together with Professor Matundar, to co-chair this report of 20 experts. As we just heard, the opportunities of artificial intelligence in health to promote health are enormous, but also along with these opportunities come difficult challenges. Essentially, what our group did was to ask some key questions. What kind of artificial intelligence should we be developing in the area of health? When should we use it, and how should we be using it? Once we frame the questions that way, a number of challenges are coming up. Some of those that we heard already, for example, around the digital divide or how the data are collecting, but also around safety of artificial intelligence systems, about the impact of artificial intelligence on labor and employment, about issues related to commercialization, and of course, the big impact of artificial intelligence in climate change and its sustainability. So starting from these challenges, our goal was not only to identify them and articulate them, which these other people also are doing, but more specifically to think of the guiding principles that will help us and those involved in this area to actually resolve the conflicts, resolve the challenges, and move on developing and deploying artificial intelligence in health that can improve the health of all people. We relied on a rather extensive body of literature and recommendations that has been already developed, but in general for artificial intelligence. And what we wanted to do is to see which principles are specifically more relevant and important in the domain of health, spanning from diagnostics to prevention, public health, all kinds of areas in this health space. And with that in mind, we drew up a list of principles where we think there is consensus that they're very relevant in guiding us, not only in developing artificial intelligence that will help us improve the health of all people, but also guiding us in deployment, the kinds of uses that we're going to put this technology to, and also in the development of public policy. And I will mention those here briefly. They're always, of course, these are important big principles with a lot of content. Just briefly, those 6 include the importance of protecting autonomy, the promotion of human well-being, human safety, and the public interest, importance to ensure transparency, explainability, and intelligibility, the need to foster responsibility and accountability, to ensure inclusiveness and equity, the big question of equity, of course, and to promote artificial intelligence that is responsive and sustainable. Now, through these principles, we identified areas of governance in which can help us resolve the challenges that we started off with. One relevant and important issue here is that these principles are consensus principles to guide action, but they are not alone in helping us developing and deploying ethical artificial intelligence. Ensuring promotion and protection of human rights is essential, and other values, of course, other ethical values as we develop and deploy these technologies in particular areas. Just to give you a flavor of the recommendations to which we were led, starting from the principles I mentioned. First of all, I want to mention that these are addressing not only governments, but also the private sector, developers, and healthcare providers and systems. So there's a wide spectrum of stakeholders that are addressed through these recommendations. For example, designers are advised here and are recommended to develop systems that are designed to perform very well-defined tasks, accurate, reliable, and tasks that are able to improve the capacity of healthcare systems, but also to advance patient interests. So we're specifying very much what needs to be done in this respect. Governments and the ways in which they have to enact laws and policies, companies and the ways in which they have to adhere to national and international regulation, and also governments and the ways in which they can support global governance for artificial intelligence for health. That way, because of course we've seen that there is one thing in enacting jurisdictional legislation, but as artificial intelligence develops and is diffused globally, we need action at the global governance level. These are, of course, a body of 47 recommendations, and as you will see when we look at the report, they are quite detailed and specific to the different stakeholders. We also developed a set of checklists or considerations, you can pick the term, addressing against the different audiences. Now, those aids, we call them aids, are not meant to exhaust the ethical thinking around artificial intelligence, but they're meant to be used by the different stakeholders to help them with the implementation of the guidance, which hopefully they will be used and be found useful in this way. The recommendations, the body of the report has the theoretical and more analytical part, the recommendations more specifically, and these checklist considerations. You can think of it as sort of three-part kind of document. Now, that's the theory and the recommendations. What we're very keen on, of course, is to implement this document. So WHO is already thinking about how we can move on to the implementation of this. And the idea here is to help regions and countries in particular engage with the report, derive from this report and from these recommendations specific actions depending on their context and area, and also include and maintain this community of experts that's been generated through this activity in order to continue thinking about this report. Perhaps what's important to close with is that this report, this kind of guidance, is quite unique in the sense that although we've had over the last few years a number of governance and recommendation documents about the ethics of artificial intelligence in general, this is the first of its kind to specifically address the domain of health. And we believe that it's going to be very helpful because precisely delineates recommendations for the specifics of the area of health and its particularities. The second important point I wanted to raise is that although we've concluded, we have consensus, and we're hoping the document will be helpful, we're viewing this document as a living document. The technology that we're addressing through this document is moving very fast. The challenges are growing. There are known unknowns along with the known risks that we're taking, and therefore we want to have this opportunity to update the document and improve it as we go along, but also make it more useful as the changes happen along the way. We're also very keen to emphasize that the document is addressing the multiple stakeholders. I mentioned this a few times already. The reason is that as it became evident through the development of this report, and we'll see it in the document as well, we believe that developing and deploying ethical artificial intelligence in health is a collective responsibility. So it's all of us and the different stakeholders that need to play a role, take the matter seriously in order for the outcome to be the one we want, which is to use this very powerful and very promising technology to improve the health of all people. And along with that, we believe, and it's apparent in the report, that it is our choice to take this responsibility to develop this kind of technology that will aim to reduce inequities, to enact law and develop public policy that ensures the technology we're developing is used to that effect. And I'll close here with that, Tariq. Thank you very much.
Thank you very much, Professor, for explaining us how we got to these principles and what is really the aim of this document. I will just maybe, before we start addressing questions that we have received in a chat, maybe just ask Professor Pakta if he would like to add something to what has been said from his perspective as a co-chair.
No, I think Effie has actually summarized it very well. The only thing that the only point that I will emphasize is that we view this as a living document, such that, we all should take this forward, we all should improve it, and nothing is static, it's all dynamic, and these ethical issues also will become more and more nuanced and more sharpened as we go along, as AI systems are deployed in areas of health. So we'll all work together, and this is not the end of it, like Effie said, but we'll all work together, multiple stakeholders, and see that this becomes a vibrant and, everybody has something to say on this and possesses it in some way and follows it and applies it.
Thank you very much, Professor Parta, for that. We are having a couple of questions in the chat, also some hands raised. And now this topic obviously concerns a really wider society. So we may have people who are not necessarily journalists but are interested in this topic. So we will be happy to take their questions as well. So I have seen one hand from Ms. Tamba Ernawati, who I understand is a public health professional from Indonesia. Ernawati, could you please unmute yourself?
Tidak jelas. Untuk kesimpulannya ini dari review ini tentang hubungan antara iklim dan penyebaran COVID-19 ini menunjukkan bahwa kondisi cuaca seperti kelembapan, curah hujan, radiasi suhu dan kecepatan angin mungkin dapat memerankan peran sekunder dalam penularan penyakit.
Ms. Tamba, unfortunately, we don't have interpretation services here, so we cannot really provide interpretation to our guests. So we will try to see a few questions that we have got. One is from Meg Divers from Graduate Institute, saying congratulations on the new guidance. Does WHO have plans to roll these out with technical assistance at regional or country level? So I think this is a very important question on how these guidances then are translated at the national level and how it is concretely being done. So I don't know who would be able to try to address these questions. Please just jump in immediately.
Maybe I can start and then I can ask our co-chairs as well as Andreas and Samir to add. So I think the DG, when he was presented with this report on Friday, said exactly that this report is not just a report that's to be put on the shelf and filed away, but it's a report that needs to be implemented because it's important. All the recommendations that are being made here have implications for public health programs in countries and for clinical care programs as well. And so this is an area which also needs a lot of research, and I think Professor Partha Mazumdar was really referring to that when he was saying that this is an evolving field. We have to learn more as AI-based systems get rolled out, particularly in the lower middle income countries. We really don't have a lot of information. And so I would flag that that countries need to take it seriously. So what will we be doing? We will of course have a series of briefings. So we're starting today with this briefing, and we have the official launch of the report later, where we will have several high-level guests, ministers of health joining us. That is going to be followed with a mission briefing as well as a briefing of ministers from capitals, hopefully next Monday. And we will invite ministers of health and ministers of information technology to participate in that briefing. This will then be followed, of course, through our regional offices and country offices. This report will be taken up with the Ministries of Health and implementation plans will be developed. It's also linked closely with our global strategy on digital health. As you know, this was adopted by the World Health Assembly in November last year, and so there's a clear roadmap and a plan of action for how countries must adopt digital technologies, and certainly AI-based tools will be part of that. So as countries are thinking about developing their infrastructure, the ecosystem, to use these tools to improve health services, ultimately we have to remember that the goal of all of these new tools is to improve health outcomes. It's not just for the sake of using a new technology. It has to result in something better than existed. And so we have to measure health outcomes. We have to measure some of the indicators to know whether this is actually helping. So we will be having a plan now for operationalization of this report, and particularly, as I mentioned, we are keen that countries that do not have perhaps a very strong technical capacity or very strong regulations around data governance should take this report seriously and really try to see how they can implement further. But perhaps our co-chairs might want to add to this.
Yes, maybe Professor Valina or Professor Pata, would you like to add something on this important issue? When you
yes, I think.
Please go ahead.
Yes, I just want to say two things. One is that along with the ethics and guidelines that will evolve, the science itself is evolving, and therefore the requirements to implement these guidelines will also evolve. And I'm pretty sure that WHO will leave no stone unturned in order that particularly the LMICs can actually see those countries that wish to implement these guidelines seriously. I'm sure the WHO will hold hands and help such countries.
Thank you very much. There was a really interesting question that came from Rashmi Singh, and I think this is what many people have in mind and have as a concern. Rashmi says, how artificial intelligence could turn adversities and challenges into opportunities in health sector, and how a common standard protocol could increase its transparency in the sector. So it's basically maybe for you, Effie, people are worried about the new technologies and how it can be used and misused, and beside these principles, how we can practically turn those challenges and those concerns into practical benefits.
Thank you. I think, of course, we're all right to be worried. And in the digital space, we've already seen a flavor we had a flavor of what, can really go wrong. So, as particularly in the domain of health, which has its own sensitivities, I think we have to be as cautious as possible. And in fact, what our guidance here is aiming in doing, and precisely giving those guiding, let's say, principles and lines of what has to be done in order to avoid that. For example, in the question, transparency is mentioned, and we did work very much on that topic, and we have an extensive section on the value of transparency in order precisely to avoid the potential misuse, but also in understanding where the stakeholders are going with its item, with its particular technology they are developing. I think the importance of following or implementing the guidance is not to give a specific answer right now to one particular challenge that is faced, but rather to create the framework within which the technology that's developed is developed in a way that reduces the kind of things that we're afraid of or minimizes it. If we do that way, then the net benefit of the technology is the one we want. That's I think the goal as well of creating this framework through these principles that we've drawn up here in this report.
Thank you very much, Effie. I would just like, because we got a question earlier in the week, is about access, because we talk about concerns, we talk about all this progress, but how the access to new technologies, artificial intelligence, can be strengthened, especially in low-income countries. and I'm not sure who would be the best person, maybe one of the co-chairs or Dr. Sumya, just to touch upon the issue of access to new technologies.
I can start. The way I look at it is it's an opportunity, especially for countries that do not have some legacy systems, which are making it difficult for interoperability, for example. It's an opportunity for countries that are investing now in health systems to integrate these tools. But there are a couple of caveats here. The first one is around data and the need for good data in order to inform these algorithms. As you know, artificial intelligence algorithms are only as good as the data on which they are trained. And if we are using a data set that's been generated in Europe for a solution that's then applied in a country in Africa, it may or may not work. It depends really on the disease and so on. And therefore, it's important for countries to also think, and the public, to think about data, health data, and how it can be used and how it can be governed. And to that effect, we're having actually a summit, a data governance summit on this week, on the 30th, really bringing together stakeholders from around the world to think about data governance principles, both for routinely collected data, public health data, patient data, but also data that comes out of research. How can this be shared, and how can more collaborative research around large data sets actually be used to improve health outcomes? So I think before you can even go to the use of AI, one has to really think in the country about how data is organized and used, health data, and what are the laws that are governing health data, and has there been a discussion with civil society, with the public, about the use of their data. This we've seen happen in some countries that have taken a very liberal view. I think these are countries perhaps where citizens have a lot of trust in government and they permit the government to use routinely collected health data, to inform policies. There are other countries and regions that have very strict rules in place as to how and when health data can be used, and there are other countries which do not have any regulations. So I think this is an area. And then about access, I think the access really is improving every day. I think the access to internet services, the cost of internet, the cost of having a mobile device, all of these are coming down. And so that may be a challenge that can be overcome soon. Again, if there is investment made into this by countries as well as by international donors and so on, then that's something that can be worked out. But I think most important is to have a national mechanism and a set of policies and regulations around how these will be deployed and used and how this is going to be governed. So it's very much really around data. That's what I believe, because the hardware and the software is something that's changing, improving all the time, and costs are coming down. But again, this is where the private sector has a very big role to play, because currently the private sector actually holds a lot of our data. The big tech companies actually have a lot of data that could be used by the WHO, for example, or by countries. So we need to start this dialogue as well on when and how this is going to happen. Again, happy for the co-chairs to add to this.
Yes, and I would really like to hear from co-chairs, because this is exactly the topic that came up when we were preparing for this. We received quite a number of emails from the industry. So how to engage this dialogue with them, and on what basis that Dr. Soumya was talking, how countries who should implement these things and regulate should take on board dialogue with the private sector, with tech companies, with the industry.
And maybe I'll jump in, because I agree with you both that this is one of the crucial issues in the development of artificial intelligence and its deployment, and something also we've touched upon in the report. At this point, it's true that a lot of the data are actually held by the private, development of algorithms, because the data is the source on which algorithms will be developed, they're also owned, and they're also in the hands, let's say, of the private sector. And what we're seeing is we're in this phase where governments, the state, has to negotiate with the private sector in order to advance this in the way that we need to be advanced. Because again, we never forget, it is for the improvement of the health of all people. And the situation, I think what we're seeing is interest on the part of the private sector in sitting at the table and negotiating with governments. So that's number one. In these negotiations, it's important that states put forward the public interest. And that's why we're also mentioned in the report the issues around commercialization of certain technologies. It's the conditions with which we engage. It is not about not engaging or rejecting or engaging fully. I think the conditions have to be transparent, they have to be legitimate, they have to be in consultation with the publics. And that's really, really crucial. And I think that's the way actually forward. We've seen interest from all sides in developing that kind of discussion, but also in keeping firm to those conditions that I just mentioned. And this, of course, applies for both, not only about the uses of the data, but also the development and uses of the algorithms, essentially, that will be crucial in this space. But perhaps Partha also would like to add something here. Thank you.
Yeah, I just want to mention, I'm not going to intersect with what you said. Those are absolutely right points. I just want to make this point that, access to artificial intelligence as a technology is kind of easy. It doesn't involve investing millions of dollars on a big piece of equipment. What is important is, first of all, any of these algorithms, will look at a set of input features, and those input features are the data that need to be collected. So there are two issues. Do we have the wherewithal to collect that data? And does the government or the society where this is going to be deployed, do they have the intent to collect that data? After all, if those data are collected, then we get into other kinds of problems like, is this the appropriate algorithm to deploy in that particular setting? Those are also issues, but I think the most important is, do we have the ability to collect the input features, the data that's required for that algorithm? And secondly, do we have the intent to collect that data? So these are two issues, proximal issues that need to be addressed first before we even talk about, other kinds of ethical issues that emanate from the deployment of such technologies. These technologies are very powerful because it does remove to a certain extent or to a large extent the subjectivity that there is in medical care. It makes it more objective, given that you have collected reliable data and the algorithm can be used in that particular setting. So you get hold of a set of objective rules in order to make predictions or, essentially to make predictions or diagnostics. So this is what I would say, that the intent to collect the data and the ability to collect such data are of paramount importance here.
Many thanks, Professor Partha and Professor Elena. Let me just here, as we will have to close soon, bring our colleague Andreas here from WHO, if he could just briefly tell us what are the concrete next steps WHO will be doing, and will this group of experts continue in time ahead as to work further on these issues?
Yeah, thank you very much, colleagues. And Tariq, can you hear me okay?
Yes, it's okay. Please go ahead, Andrew.
So as Sunya already said, we will not be shelving this report, but on the contrary, this is really the start of our project. And as others have said, the member states and countries will need a lot of support, as this is a very quickly evolving field. So the first next step we're taking already next week is to organize a mission briefing for all of our member states to discuss with them what this report means and what kind of support they will need in the implementation of this report. I think it's very important for countries to keep abreast of this quickly evolving technology. they need to be ready. We need to ensure country readiness for adapting these technologies, and there are a set of issues and questions that need to be addressed. For example, is a given AI tool cost effective in a specific context compared to more traditional methods of delivering healthcare? That, of course, is a tough question in contexts where there's not even enough resources to provide basic healthcare. So that's one question to face. And then there's also a lot of questions, as we have said already, about the readiness in terms of the regulatory authorities and the ethics support. There should also be some technology experts in ministries of health. So there needs to be capacity building in all these areas. And finally, also the health workforce needs to be trained with these new tools so that they can successfully deploy them. And these are all areas where WHO will be providing the necessary support to the regions and countries. Over.
Thank you very much, Andreas. We have really few minutes left, so I would just ask maybe our co-chairs for the final word, as this audio file will be sent to our global media list. So maybe just a final thought on how we should all of us who are not really expert in this, how we should understand the importance of the artificial intelligence and health and for the future.
I would only say that we should continue to work together, and by we, I mean all kinds of stakeholders, because the science is evolving, and with the evolution of the science, it becomes more powerful, and with power there will be new ethical issues that will arise, access issues and other kinds of ethical issues that will arise. And I would only say that we should all work together such that artificial intelligence for health becomes a panacea for most of the world, and universal health coverage can be used. Artificial intelligence can be used to meaningfully make universal health coverage a reality.
Thank you. That's the key word: universal health coverage, and how we can get it there. Professor Vallena.
I'll echo Professor Martunder's comment. I think where we're going with artificial intelligence is a collective responsibility, but it's also a choice. We're not going to be driven by the technology. We can drive technology, and we can drive its outcomes. And key to that is the commitment to governance. Technology requires commitment to governance in order to achieve the goals that we set. In this case, we want to improve the health of all people.
Thank you very much. I think the message is very clear. And the last word for Dr. Swaminathan before we conclude the press briefing.
Thank you, Tariq, and thanks to all our listeners for having asked some really interesting questions as well. This is an area which is of obviously high importance for us. It's linked with our global strategy on digital health as well. And as you know, we have a whole department of digital health that was created in WHO, and which we are planning to strengthen further, as well as strengthening the ethics and governance unit that we have. So our main focus now in the coming weeks and months will be on developing an implementation plan for this report, and trying to engage with as many member states as possible to see, who would like to take a lead on this. And side by side, we're going to be working along with our division of data delivery and analytics on the data governance issues as well, because both of these will have to proceed in parallel, and similar questions come up when we talk about data. So that's the plan, and I'm sure that we can update folks from time to time on this topic, which is obviously of great interest to people around the world. But again, while it offers a lot of potential, artificial intelligence, it's not the solution for everything. And in fact, we have to be quite careful, because it can sometimes have biases that have been inbuilt into the way the algorithms have been developed. And I'm sure everyone's heard and read about the biases in the algorithms that are used by Facebook, for example. So this is something I think at least now there's a good awareness about this, and so it is then possible to address it and look at the way that this is developed in order to avoid those kind of pitfalls. So again, as we learn through experience, we need to feed back and keep on helping to improve. So thank you very much to everyone, and back to you, Tariq.
Thank you very much to all four of you. I think the message was clear how to turn artificial intelligence into a tool to achieve health for all and universal health coverage. I will remind everyone that there will be a webinar at 12 o'clock later with the links that have been sent. We will have the audio file from this briefing sent to our global list, and the report and the press release will go live on our website at WHO in a few minutes. With that, I'll thank everyone and wish you a nice rest of the day.
Thank you for listening today, and thank you for supporting us with our sponsors. Please go to depictions.media for more information and click on our contact link and let us know how we can help bring your story and help bring us to a better world. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.